Now, the third factor, as I mentioned, is protein binding. Now, the proteins are out in the tissues, so tissues have a lot of proteins within tissues, and the local anesthetic molecules will stick to the tissues. The more highly protein bound the agent is, the longer duration of action you're going to get. So if we assign a value of, say, 65 to lidocaine, you can see it has a duration of action of around 90 minutes, whereas you can see that articaine is much more highly protein bound, and therefore it's going to give you a much longer duration of action than even lidocaine will. So it's an agent to consider because it sticks to the tissue proteins. The other advantage of having the agents stay attached to the tissue proteins is that then they don't get into the central circulation, and then therefore there's a less systemic uptake of the agents as well too. So let's look for an example like this. This is a fairly common situation. We have teeth that are abscessed or infected. We may be electing to do endodontic treatment on this tooth, or do extraction, or even just drain the infection. And so here we're not dealing with a life-threatening infection. We have something that's very well localized. The body is walling it off quite well. But obviously we need to get the patient out of pain, get the infection under control, and then provide definitive care to this tooth. So if we look at infection, and sort of the rule of thumb has always been to say, well, when we have areas of infection, it lowers the pH. So again, our normal pH was 7.4. Say, for example, in this situation, the pH drops down to 6 in an area of infection. So instead of depositing the 100 molecules that we showed earlier, instead roughly depositing 1,000 molecules, you can see what happens here with the pKa of 7.9 of lidocaine, that only 10 molecules out of those 1,000 will be in the base form, and therefore available to go through that nerve membrane, again that lipid membrane. Once it gets inside the nerve, this pH inside the nerve is very tightly controlled, so the pH will remain intracellularly or within the nerve sheath itself at 7.4. So we're going to again break down into that 75-25 ratio. So 7.5 molecules are now available to actually block the nerve conduction. So it shows you why it's much more difficult in situations of infection to get true or potent anesthesia. Now, there are a lot of other factors that are going on in areas of infection besides just the fact that the pH is lower. We have other mediators of infection that are released by the tissues when there's infection, increase prostaglandins, and these things also tend to interfere with the binding of the local anesthetic molecule to the nerve receptor sites. So it may not just be as simple as a lower pH, but it's certainly one factor. So we'll talk about how we deal with that and compensating for infection. So first of all, we want to use an agent with a lower pKa that's available. So having something with a lower pKa, again, is going to allow more of those base molecules to be available, even with a lower tissue pH, to cross that nerve membrane. And again, in contrast with lidocaine, by using articaine with a lower pKa of 7.8, we'll have more of those molecules available for our use.